Okay, welcome back, folks, to a special edition of Free My Pain Now with Dr. Matt Ort. And I have a really great friend and peer, Dr. Matt Ort. Matt, welcome to our show, sir.
What's going on, Dr. Duro? It's great to be on with you. I'm excited.
Hey, we go way back. We both actually played lacrosse at a wonderful university, Nazareth College of Rochester. And
actually, and Dr. Duro is the reason I became a chiropractor.
That's right.
Which is phenomenal. So we've known each other, gosh, almost 20 years at this point. And, his enthusiasm, his pure energy is really what got me into the chiropractic world. So I owe such a debt of gratitude to you. So this is really exciting for me, an opportunity to get on with you. This is great.
Yeah. And listen, I think I was about your age when you came in to see me. So, but it's been awesome to watch you really turn into a wonderful chiropractor. You went to Palmer College in Florida.
Yep.
You opened up your first practice in Orlando. You've worked with some high-end athletes, professional athletes, specifically players on the PGA Tour. And, you've done some really great work and really excited to have you as part of our TRT sales team as well. So, and you're also a national certified trainer. You go into different clinics around the country and you help them implement this wonderful device.
Yeah, no, it's phenomenal. And again, owe you a debt of gratitude for that as well. Bringing me on board for such an amazing product. You were telling me about this product for years and years, and I kind of dismissed it in the beginning. And then, when I started seeing these things fall into place and seeing the response that people are having, it was like, okay, he might be onto something here. And so I appreciate you offering me the opportunity to do this, because I'm seeing such a tremendous amount of positivity and great things happening out there, which is unbelievable.
I think you said it to me best. You're like, all right, you saw all my stuff on Facebook and you're like, all right, I got to check this out. And you had a bad knee, surgery on your knee when you were 19.
So I tore my ACL 3 times actually playing lacrosse. First time was 19 or 18, I'm sorry. And then the second 2 was 20 and 21. And the interesting thing for me, and probably many people out there experience, is when we did the TRT on my left knee, which was the knee I had my operations on, I could feel the TRT machine doing its thing. But then we switched it over to the right knee to see what the right knee was doing. And holy cow, from the many, many, many years that I was favoring the right side of my body, it went to show me that there was some stuff going on the right side that needed some work to get done. And, I'm great and excited for today, because I think what we're going to discover today is a little bit of why on the right side, I started to feel the machine more so than walking around and saying, well, my left knee, I've got arthritis in there. I feel that. My right knee I don't necessarily feel, but the machine told me something different. And that's where the key is.
Yeah, and great point. And, one of the reasons why we wanted to do this is we've had a big influx of doctors from all over the country that have shown, they want to learn more about this. And honestly, I'm on the phone 3 or 4 days a week. I'm talking to 6 to 8 doctors. I know you're doing at least that as well, chatting with different doctors around the country. And we put together the top 10 questions and emails that doctors and providers are asking. So without further ado, let's look at this. The first one is, we get it all the time: does insurance pay for this? And I always answer no, but I'm glad, currently
Right.
They don't. This is, I think it's done very well in the chiropractic market because there are a lot of services that we use that aren't covered by insurance. So our profession has for years had to be able to utilize techniques and devices that aren't covered by insurance.
And a lot of cash-based practices out there, like you're saying, which is phenomenal.
Mm-hmm. So the other thing I wanted to say is that as of November 2019, we're realizing that we just FDA cleared us as a Class 2 device for treating diabetic wounds and ulcers. So there's a very good chance that at the end of this year, we will be able to getting paid for this. This will be on the Medicare reimbursement schedule.
Well, yeah, and don't forget about the connective tissue activation that it's also cleared for as a type 2 device. And interestingly enough, I'm starting to hear a little bit of chatter about this out in the real world in regards to the VA hospital and what Trump is doing for our veterans and allowing them to start to seek care outside of the VA hospital when necessary, and having some of those individuals come into, say, a chiropractor's office, having treatment done, TRT done on their on a certain part of their body, and then them taking those fees and passing along to insurance companies. So I'm starting to see some chatter on that. So I'd be curious to see how that continues to play out, but absolutely starting to happen.
Yeah, there is a very good chance that, doctors that have this device will be reimbursed for treating our veterans. And we'd be remiss if we didn't mention that we have this in Beaumont Military Hospital and the VA hospital in El Paso, Texas. Also, Walter Reed. Yep. So, and one of the reasons we brought you on, Matt, is because you have a wonderful connection and background with working with the military. So, number two, how is it on degenerative joint disease? And I'm glad I brought you in on this, because one of the things I taught you early on is, like, not only do we get great results, but we want to document this. One of the things my wife said to me early, I would come home from my practice, I'm like, honey, you're not going to believe this. We took this patient, she was in a walker, and now she's no cane, nothing. And she said, no one's going to believe you. You've got to take videos of this. I'm like, okay. So that's part of our training, right?
Right.
And you have a pretty cool story, because
I do. It's interesting. And you could probably, if you're watching this, you have these kind of questions. Interestingly enough, we have a tremendous amount of phenomenal marketing material that has been created, and one of which has become viral as of recent is, and you might recognize my voice on the recording, is a gentleman having his right knee worked on, and he gets off the table, and we ask him how much pain he has. Like, oh, I've got no pain. Cool. Let's have you walk down the hall. And he walks down the hall, and he gets to the end. He starts running in place. Well, that's actually my dad. And some people were commenting like, oh my God, that's absolutely amazing. Other people are like, there's no way. I'm here to attest that was my father. And I got to see this exact scenario play out firsthand, where my dad was told he needed a complete knee replacement. And we flew him down from New York to get treated with the machine, and had phenomenal results. And obviously he was bone on bone.
And he didn't have surgery.
Didn't have surgery.
So yeah, I mean, obviously this decreases pain. FDA has cleared it to help improve circulation, decrease pain. And, bone on bone, I mean, it's an X-ray, right? Most of the time it's a two-dimensional film, and they're trying to take a three-dimensional human being and get an idea. Because of X-ray distortion, sometimes it does look like bone on bone. So I think that's one of the other reasons that we're getting some good results.
Yeah. And to add to that too, real quick, Matt, is, sometimes individuals that need knee replacements or different types of joint replacements because of bone on bone are a little bit older in life. And, it might not be the end all be all. However, it can postpone a surgery or postpone an operation. They might not need to go under the knife. If they get this treatment done and it makes them feel better, where they're able to continue their activities of daily living and avoid the surgery, then we've prolonged that for them. So that's another way to think about it.
It gives them options. It's not the panacea, right, but it pairs well with other treatments like chiropractic, decompression, things like that. So great. Can you do this on patients who've had joint replacement surgeries?
And get this quite a bit, actually.
We do. And the answer is absolutely yes. And we've had dozens of our own patients, even family members, who have had joint replacements that we're able to use this on. The other thing is, those patients are not stem cell candidates. So they get thrown out. They're disqualified, which is a great thing, because it probably saved them, $7,000 in injecting stem cells.
And they're not stem cells injectable qualified because of the replacement of the joint that they had, right?
That's right. So yeah, patients are doing really wonderful with that, and I'm very happy. It seems like the other thing is, for a fraction of the cost of stem cells, they can get a series of tissue regeneration treatments, and over a 5 or 6 week period. And again, healing takes time. And we see the true benefits are anywhere from 8 to 12 weeks after treatment has finished. after talking to all these doctors, it seems like many of them are at an all-time low for the clinics. They don't know how to rebound. They don't even know if they wanna. I mean, I'm talking my perfect doctor that I love to sell this to has been in practice for 20 to 30 years. His body's wearing down a little bit. I tell him, you don't just need this for your patients and your community. You need it for you, right? And it's given me my wrists and my hips and my low back just an extra, it's that secret sauce that I have. And I keep beating my buddy Don Stafford in golf. Like he doesn't understand why, but this is my secret sauce. But yes, you're seeing this too, right, Matt? I mean,
oh, absolutely. And the other thing about right now, especially with the current state of the world and the coronavirus and the notion that, people are very hesitant to touch other people, touch certain things. I've actually been hearing from docs. I was actually just on the phone a couple of days ago with a doc that has TRT that said the TRT machine has been floating his practice. He's been having people come in that don't necessarily want that hand-on hand, and they're using the TRT machine. So it's actually floating the practice they have now, and they're utilizing it and corresponding or coupling it with the marketing and the videos that we're sending out to get new patients pulled in, and they're literally floating their entire practice with one machine. Now they might be working on a skeleton schedule, but still using this machine is allowing them to maintain a practice, maintain their livelihood as much as they can. And that to me is phenomenal. And by the way, getting remarkable and unbelievable responses.
Right. And the other thing is, when I first kind of developed this program with this device, I would bring it into a clinic, and all we had was internal marketing, right? So most of these clinics, they could use their existing patient database, and for 4 months, they would be able to fill the clinic up and do well with it. What I'm noticing post-COVID is that the doctors need our marketing as well, because not only will we do a wonderful activation to get their existing patients back in, but we have it's like a 1-2 punch. We have an unbelievable social marketing campaign really built organically from the videos that you and I have done and other doctors, and we've compiled them all. And it seems like every week we see what would be considered a medical miracle coming out of one of these TRT centers. So that's pretty cool, and I'm excited about that.
Well, and just to feed off that, and I kind of catch myself doing this, being that we're at home a lot more so than normal, is I'm on my phone quite a bit, and I catch myself, and I have to say, okay, Matt, put your phone down. I'm looking at things like Facebook and Instagram and other social media outlets constantly, and you go to think about the type of marketing and the videos that we put together. You have patients out there that are doing the same thing that I do with my phone. They're looking at Facebook. So now all of a sudden they scroll through and they see something that a doc has posted of a guy walking down a hallway that needed a total knee replacement. And I mean, that in itself is driving more and more people to these practices, and why they're able to float with one machine like that. So utilizing now's the time to pounce on it, because the reality is we have like you said, the marketing material, the videos, and the best part of all is we have the outcomes that have proven great results.
And that started it all, right?
Yep.
Nothing.
Oh yeah.
Nothing comes from that. It's it's been fun to watch this kind of roll out. Next one, number 5. I wanted this to be like the David Letterman top 10, but it's not. It's not. Can you use it for men's and women's sexual health needs? We talk about this all the time. I don't want to sell this to other peers in our profession so that they can do erectile dysfunction in their clinics. I mean, this probably one of the most versatile devices that we've seen in 25 years with the least amount of side effects. In fact, FDA has cleared it as an NSR, a non-significant risk, because there's minimal issues. That being said, every urologist in the next 2 to 3 years is going to have what's called the Uragold 100, which is more of a focused tip. It's a little more expensive than our model, because they're getting such wonderful results with erectile dysfunction. So Dr. Erwin Goldstein in San Diego at the university, no, he's not at the university. He's at the men's and women's sexual wellness clinic in San Diego, and he's doing some phenomenal work. He's now utilizing this device not only on the genitals of men and women, but he's actually putting it on the lumbar plexus, and switched from like getting 65% improvement to 80% success rate with erectile dysfunction. So that's huge. And obviously I want doctors that have multidisciplinary clinics. This is beautiful.
Perfect.
But, doctors are going to have to check their state laws, right? That's not what we do. I mean, we do some compliance, but we're looking at putting this in for general pain. And that's where we're seeing it work so well in our clinic.
Well, and I think you kind of hit a good point there too, is the fact that as a chiropractor, we absolutely go after the lumbar spine, the lumbar plexus, right? So even if they were a chiropractor, like you said earlier, I would never use this in a practice for men's sexual health or female sexual health, but a subsidiary of utilizing on the lumbar plexus and lumbar spine is going to have a direct relation to that area. So, but like you said, I mean, the fact that it creates new blood supply to regions of the body, it's no wonder that this thing has such a great effect on erectile dysfunction. And
it's getting to the true source,
right?
Right, which is a blood flow issue, and we'll keep an eye on it. I'm really excited about the results, and we do have a multidisciplinary clinic. So we have 3 nurse practitioners that do all of our men's and women's sexual health. I just may be a little bit out of our scope. Do you have to be a doctor to use this device?
It's interesting. We get this question quite a bit, especially when we're doing trainings, and even before we do trainings, we'll have them bring their staff in. It's really a really good tool and an opportunity for the doctor to be the one to begin the initial treatment, the initial pain, or what we call mapping out or discovering areas, because obviously the doctor is the one that can create the care plans, can create what the protocol is going to be for that particular patient. And also adds a little bit of, hey, I'm the doctor and this is your care. But we also see, and we also do train a lot of massage therapists that control the TRT machine in practices, CAs that also do it, and even people that are hired on in a practice to specifically do this. So
yeah, and good point. And I like one of the doctors or mid-levels to do the initial exam. Right. We'll talk about the patent pending protocol that I've put together and how basically in 10 minutes we're able to, use this from a diagnostic standpoint, and then detect areas of inflammation and really find the root cause of this pain. But then we turn it down a notch into a healing mode and start the healing treatment. All this in 10 minutes. And that's part of our marketing program. And we have both a national campaign that we're working in conjunction with Cox Media. So they went through this commercial and our different websites with really with a fine tooth comb to look at everything to make sure it was compliant. So I'm really happy with that. But after that initial exam, 80% of the treatments, even in my clinic, are done by medical assistants or CAs. And we've seen retired massage therapists working really well in other clinics around the country.
Yeah, and I think, Matt, it's a good time to bring up the fact that the TRT is such a phenomenal piece of equipment that it actually can provide a degree of diagnosis. And what I mean by that is when you use a TRT machine and you run it over normal functioning tissue, it elicits no response from the patient. It's quite remarkable.
No pain.
But no pain whatsoever. But as soon as you hit an area of dysfunction, tissue that doesn't quite move properly, or inflammation, a patient can literally pinpoint right there where that pain is. So it's also used as a diagnostic tool, which can then in turn give immediate feedback to the patient on what you're doing. So when the doctor, what we call mapping out, say we're mapping out a knee, like you see in a lot of the marketing videos, you're rubbing around. It's like, oh, I don't feel anything. Boom, right there. Medial joint line. That's right where I feel it. So then we know moving forward where to treat the areas. It's remarkably, I don't want to say simple because that phrase is too light, but it's remarkable.
It's that biofeedback component that the Chicago Cubs like, the Cleveland Indians, New York Knicks, New York Nets, they're able to run it, scan this over an area and detect it. And it's funny, it doesn't matter if we're in Tupelo, Mississippi, Santa Cruz, California, Atlanta, Georgia, Orlando, Florida, people are like, right there.
Right.
they know it.
Oh, it's great. And that's to the point we talked about earlier with my knees. When we put it on my right knee feels great. When I walk around, I don't feel anything. But as soon as we got TRT on it, you could tell right away that I've been favoring that side, and that it's only a matter of time before the joint space side starts to deteriorate, the discs in there or the cartilage in there starts to deteriorate, and I develop arthritis. It's only a matter of time. So now if I can get ahead of that and don't ever have to have bone on bone, then I'm going to do that. Or if I'm an athlete and I'm having a little bit of, maybe shoulder, elbow issues, maybe I don't know if I have it or not. I get this machine on there. I can definitively tell you whether you will or won't.
Yeah, good point. How much does each session cost? How much do you charge? And the cool thing is, again, this is regenerative medicine options for the everyday working man, right? We've talked about this in other podcasts, but stem cells may be the future of healthcare, but right now they're the future for millionaires and professional athletes. So this can range anywhere from $75 on the low end up to $450 on the higher end, all depending on the size of area that we're treating and the severity. But typically, I would say an average visit is about $175 to $200 in our clinics.
And to that point too, just so the listeners understand what a treatment is based on the number of shock waves that are utilized during that particular treatment, which on average is around 500 shock waves per treatment. So if I was treating Maddie's knee, I keep going back to the knee. It's always on my mind, I guess. We would do 500 shock waves into his knee. Maybe the first visit where we're doing that mapping out, as we talked about, we might throw 750 just to kind of get a better understanding of what's going on with the knee. But an average treatment is 500 shock waves. And that's right where what falls in line with that 150 to 300.
And we've made it affordable, right? I mean, we want to find out if these patients are candidates. That's why we've created the $49 introductory special.
Yeah.
This isn't about like bait and switching people. This is about finding out if they're good candidates for this type of treatment. Because honestly, from the diagnostic standpoint, if we do my shoulder and I have no pain, that's not really the area. We have to look above, below. Sometimes it's the elbow, sometimes it's cervical spine, but it will help us. Get that.
Well, and to that point too.
Yep.
Say you have a patient comes in, right? I come in and I've got low back pain, I've got knee pain, and I've got shoulder pain, and I want TRT done. So what we do is when we train our people to do is say, okay, or even as a doctor, you may already know this, but what is your primary? What is the primary complaint? What is the primary source of your pain, the thing that is reducing your activities of daily living? And most of the time we'll say low back. Okay, great. That's their primary. And that's where we're going to focus all the energies for the first 3 to 4 weeks. Then from there, we might go to, okay, what's their secondary? Let's say it's their knee. Okay, so then the next couple of weeks we'll treat their knee, and then the tertiary would be their shoulder. So we're identifying in the beginning, okay, what are our 3 primaries? Okay, let's hit the very, very first primary and then move from there. And that's when we're starting to see the most results, because as you mentioned earlier, there's about that 8 to 12 week cycle where the biggest number of stem cells are migrating to the area of treatment. So let's focus on their primary. Let's get the primary working and functioning correctly, coupled with everything else that you do in your practices, like we all do, and then go on to the secondary and tertiary treatments.
Great point. And we are following the Director of Healthcare protocol from Austria. His name is Dr. Wolfgang Schaden, amazing gentleman. So many people around started out, they would do shoulder, then they would do the knee, and then they would do the foot, right? And you have a limited amount of stem cell in your body and helper cells. So if you spread them out to 3 different parts or 3 different continents, they're not going to, be able to focus their strength. So we want to focus all of this intelligent energy to the primary spot. And that's what you've done really well, Matt, to help us pass that on. And that's a great point.
Well, I think it
Number
leads
8.
right into number 8. Yeah.
Yeah. Number 8, how long does each session take? Again, we have developed a patent pending protocol. Okay. I come from a high volume practice. I saw 280 to 300 patients a week. It's probably why I blew out my shoulder and wrist. And, you know, I didn't want to spend 15, 20, 25 minutes with these patients because of volume, right? And what I found is it's not about how much time you spend with a patient that gets them better. You know, they talk about the chiropractic adjustments like flipping on a light switch. It turns on, it's that quick. If it was about time and with a patient, massage therapists would get everybody healthy, right? Because they spend 45 minutes to an hour and a half. Not to take anything away from what they do, but this is literally, you know, it's 10 minutes to diagnose, detect areas of inflammation, locate the true source of pain, and start the healing process. And it's that easy. And we will show the doctors during their training days. So,
yeah, and it's a good point too to say, you know, when we're talking about the time, right? If we're efficiently working on certain areas with effective pinpoint accuracy, then the amount of time that we need to spend with them is reduced because we're effectively utilizing the time to pinpoint and correct, right? So 10 minutes.
I want our practitioners to be surgical with this.
Right.
The energy that they put into this patient's body, they have to be mindful of that, right? I always say less is more. We start with less and we build on each. That's what a care plan does. That's what you do in the algorithm of healthcare. You make sure this patient can absorb and accept it. So we have that phrase, you know, that you'll see on our national TV spots. Give us 10 minutes, we'll give you your life back. And I mean that. I mean, I want doctors to be able to see 5, 6 patients in an hour. Well, this is going to be a little longer. We don't have to go through all of this. If you're interested in getting this top 10 list, and we've got 3 or 4 extra, you can go to the stemcellmachine.com, fill out a little intake form, and then we will get you information, and you can put in there, hey, we want this top 10 list. It's an interactive link. You can look at different YouTube channels, snippets from podcasts that answer a lot of these as well. So number 9, what's the difference between the Gainswave instrument or a radial device and this extracorporeal shockwave therapy? I get this all the time. I've been answering it for 3 years. The difference is pretty similar. One of the devices is mechanical. It's like a radial device that has a little piston that pounds on the tissue. It works on a centimeter to 2 centimeters in, and it creates trauma. And it's got about that much surface area. See the head of that pen? So that is a radial device. The pulse or the wave is consistent, much like an ultrasound. Now, ours, which is considered true, genuine lithotripsy, has this high spike, so it's a positive pressure, and then a negative tensile force down here, all within 3 to 4 microseconds. So it's really quick. It's like taking a thunderbolt and lightning and put it into a head of an applicator that we can point at something, right? It's very futuristic. So ours works on a cellular level. It's going, 8 to 10 inches. It's compressing the cell membrane or the cell first, and then expanding it by 10%. And that negative tensile force is what creates a shearing pressure that knocks away any of oxidative agents or stresses that have built up, in fibrosis around that cell membrane. And I think that's why it does so well on chronic injuries that have been there 10 years, 12 years, 18 months, 15 months. It just allows that cell to get normal diffusion of nutrients in and waste products out, plus exosomes. Anything else, Matt?
You can, oh, totally. And you can add it at the biological level of what the Ortho Gold or the extracorporeal shockwave is able to do. I mean, what's the powerhouse of the cell?
The mitochondria.
The mitochondria. So that's going to have an effect directly on the mitochondria. And you know, real quick, I've had this really, really sweet patient, and she was actually from Puerto Rico, and unfortunately the doc she would see in Puerto Rico had passed away, but she did have a radial device. So she's actually experienced both the radial and the OrthoGold 100. And during treatment, after the treatment, actually, I should say, she compared the two, and she said the radial device, it almost felt like I was getting a tattoo with the radial device. And again, when you showed that the pen tip and it's doing this, she said it felt like she was getting a tattoo, where what she felt like with the OrthoGold was that it was deeper penetrating and getting to the source of what her actual issues were. And when she got off the table, the smile that she had right on her face, and knowing that it's not going to take 12 treatments with a radial device feeling like a tattoo, where this could take about 3 treatments to get her better. She was she was amazingly happy and excited about that.
You remind me of a good point. This is the surface area. To do a hand, can you imagine how long it takes? Now, the size of our unfocused device is like this much. So look at the difference. It takes me 3 minutes to do a hand to, 15 or 20 minutes to do this. Let alone if you're going to put this on a male genital, you actually have to put a numbing cream on 20 minutes before, and then hope to God it doesn't leave any divots in your and your jewels. Well, so we have this in the list that we can send them. We have the Art of the Shockwave, which was actually developed as a promotional piece from one of our competitors, and they referenced 26 different studies, of which 24 of them are extracorporeal shockwave. And there was 2 that they used the radial device, the pulse wave. And that's the difference. Again, 1/8 of the biological effect that our device has. And I'll stand behind that anywhere in any doctor's office in the country.
And just to throw this out too, Matt, real quick, is we'll probably touch a little bit more on it, but there's 130 plus peer-reviewed articles on the website.
Yeah, that's right. So, and we have that link on there if they request this information.
Right. And the point I wanted to make when you were showing it on your hand, the little pen point versus the TRT, time is money. We've just discussed that. Mm-hmm. Time is money. This or this, right? So it just makes sense to be able to treat quicker.
If you like being with your patients longer, get that one. Get the radial device, because you're going to spend 2.5 times longer with them.
Without the result.
Okay. Is this really a stem cell machine? Wow.
Now, according to the TV show The Doctors.
So, it's funny. We submitted the research to the associate producers of The Doctors. We had to work with their research assistants. We worked directly with Germany, MTS, who's our parent company, to Sarah Engels, who's our research director. She sent me 8 of the studies, and she put it in there. And it was, one of the associate producers said, why don't you just call it what it is? This is the stem cell machine. And they actually featured it on a segment of their show called The Real Deal. Is this the real deal? And for weeks, we had no idea what they were going to say. We're like, we were on pins and needles a little bit, but we obviously had faith in this device and stood behind the studies. So it was nice that they said that. Now, understand these are animal studies, and the thing that I want to say is, we haven't proven it to be an absolute moral certainty, right? But we have a good basis from these studies to believe it will be confirmed to be found true in human studies. And it has been generally found that most animal results are eventually found to be reliable in humans. And it was, again, nicknamed the stem cell machine by the nationally syndicated show, The Doctors.
Yeah, so Matt, I don't even know if you know this, but one of the dear friends, docs that I have that have the TRT machine here in Central Florida, his sister actually works in a stem cell lab in New York City.
Yes.
And he said, Matt, I'm not, send me all the research. I'll have her vet it out. And he owns a TRT machine today because of the feedback that she gave him based on the knowledge that she has working in one of the best stem cell labs probably in the world. And they have the machine there, which is, again,
It's pretty cool. And Dr.
phenomenal.
Thomas Liu out of University of California, San Francisco, we're privy to see some of his research. He actually has an organ regeneration lab in San Francisco. So he's tissue recreation, tissue regeneration. We have a patent. He has a patent on organ regeneration. So, we're just looking at where it's going to be 2 or 3 years from now. And I'm just glad I bought the domain, the stem cell machine.com. So, again, one of the docs I talked to that is in the process of getting one of these devices, he went with a group, and there's a chiropractic consultant that's been around for 35, 40 years who's pitching stem cell clinics. And this young man who's been in chiropractic 24 years, he invested $210,000. I mean, he went into his savings. He and his wife made this decision, and stem cells has been a flop. He is like, Matt, I need this device to work. If it's as good as you say it is, this is hopefully going to be a saving grace. I'm like, look, I don't want it to be a Hail Mary pass. I know it works. I know it works. I just don't know how fast it will catch on in your community. So, I want people to think about this before they go for something invasive that is expensive, right? You have to exhaust everything that is less invasive, less expensive before you go on to those more extreme things, correct?
Totally. And you know what? This is the 11th question that we're going to just throw out there at you, but it sounds too good to be true, Matty. It does. Right?
Yeah. I mean, that's what I get from, obviously, I'm very passionate about this. I'll never forget, we were at a restaurant down in Inman Park, you and I and your cousin who's a nurse. And I was just like, oh my God, it does this, it does this. It's a floor wax, it's a dessert topping, it slices. And you find you guys are like, oh, this guy's crazy. I'm almost too passionate, and I've really, because of my ADD, I'm kind of all over the place, but I need to be a little bit more focused. That's why I'm trying to stick with us as general pain, chronic pain. This thing works well. I want these doctors to do the research. This is a big investment. But what we've developed is a productivity and profitability increasing system for their clinics, right? They're going to get people better quicker. They're going to love the results, and they're also going to make money. But, if someone pays you $1, you're going to give them $2 to $3 in return. That's how they feel. And that's how patients, that's why they are so thankful when we help them that they go tell 5, 6, 7 other people, right?
Oh,
and that's what we're finding.
The word of mouth is phenomenal. And like you said, and you told us all these great things. Well, what did I go and do? Well, I went out and did my own research. I pulled out these 130 plus peer-reviewed articles, and I skimmed through some of them, and I read in depth in other ones of them, or other articles. And I implore people to do that. We live in an age where there's a lot of misinformation out there, right? What do you believe in? What don't you believe in? Do the research, go find the papers, read the articles, have it done on yourself, see how it feels, see how it makes you feel. Do your research, take our word, but then take our word and go and find the articles on the website and read through them and do your research.
Very good. I submitted an article to Forbes. There was too many run-on sentences. It didn't make them, but it may make the Inc. or Fortune magazine. And it was titled "The Most Versatile Medical Device That You've Never Heard of," right? Because people there's something in their brain when they hear this, it does this, it does that, it does this. They just kind of turn off, and they have this like red flag warning. This can't be that good. How come I haven't heard about it? Well, you'll remember Matt Ort and Matt Doduro, because we may be in the first providers and doctors to ever really bring this to you in this format. So yes, again, get their research, do their due diligence. I want them to be skeptical. I've already done it. I've spent the last 3 years doing this. The other quick questions that we get is, how does it work with decompression? How does it work with cold lasers? I think this pairs so well with whatever technology. I don't know if it's a standalone by itself, but I will tell you, I think as chiropractors, in our manipulative therapy that we do, I think it just gives us superhero healing powers, really, because not only are we going to detect that area of misalignment or joint dysfunction, but we're going to remove it. And then we're going to put a treatment like this light therapy, this genuine lithotripsy on that area to accelerate healing and get people better quicker. Matt, what are the 3 areas we can't use this on?
Well, so they're going to be kind of obvious. There's one that's not so obvious, but we're not going to do it on fetal tissue. So a pregnant woman, we're not going to run into that. Somebody that has had a pacemaker put in, we're not going to run the TRT over that. Now, the third one, you might say, okay, I wouldn't have thought of that. But the third one is somebody that just had a cortisone injection in that area. So say I've got, let's go to my hip this time. I said my knee last time. I've got hip pain. I come into the office. My other doc, my primary care, gave me an injection there. I come to the office. I say I want to get my hip treated because it hurts. Well, we can't necessarily treat that particular region for up to about 4 weeks because of the injection. So again, think below, think above. We'll treat the ankle. We'll treat the foot. We'll treat the low back. The
4 week is safe, but we like 17 to 21 days. And for some reason, when we use these sound waves that are coming out at 3,355 miles an hour, it disperses the cortisone that's been lying dormant in the tissue that didn't hit the region. And that can be a little sore. So we do avoid that. The other one, and this is, important as well, is we don't want to use it on the end plates of young adolescents, right? Why, Matt?
Well, they're still growing. They're still,
But it will accelerate or close the growth plates at those epithelial growth. And that's
what you don't want. I mean, they're growing. That's why the plates are open, is because they're still growing. You don't want that closed, as most docs out there would know. But
this shows me, though, that it accelerates healing. And another reason why you wouldn't want to do it on those growth plates. Now, I have used it on long bone fractures in the middle. I've used it on Osgood-Schlatter's. It works really wonderful. It's very, very beneficial.
Well, and just to put, I guess, a little bit of plug for what you're doing with the Free My Pain Now radio podcast, everything you're doing, go back and look at some of that stuff that he's done. I think one of the most remarkable pieces of information that I heard was a diabetic neuropathy patient who had stepped on a piece of glass and was walking around for 3 weeks or 12 days, whatever it was, with a piece of glass in his foot, and he had no clue that it was there. So then what happens? The foot becomes basically necrotic, infected, loses his third metatarsal. Pretty much they have to amputate
the distal end. Yep.
The distal end gone. I mean, the pictures, if you can stomach them, go look at them. It's unbelievable.
It's episode 8 of Free My Pain Now with Dr. John Mullins, who's a plastic surgeon. Good memory. Thank you.
But they did that. But I mean, tell him, Maddie, they did it over this open wound, and the wound, I never. I mean, I could be wrong, but I never saw it actually scar over it. It just like
that's right.
It just regenerated and
never scabbed.
And they did X-ray, and did they not see some bone growth back in that?
Yeah, that distal third phalanx. Yeah, it was like a starfish, is the way Dr. Mullins described it. And he's been a physician for 37 years. And I love bringing these experts on my show because it's not me talking about it. You and I, it's a little different. We're loving it. We're getting good things. How much does it cost? Can I afford it? I honestly believe your clinic can't afford not to have this. We make it very affordable. We have leasing options. They can do deferred payments for 3 months, especially getting out of this COVID. That's a wonderful one. Matt and I will show you the protocols on the business side, how to pay this off in 3 months. And any joint venture, any business venture that you can pay off within a year, I think that's a good thing to bet your money on.
Oh, no doubt. And I spoke earlier a bit about one of the docs I was talking to earlier in the week that is the TRT is literally floating his entire practice. Well, he's still in that 6-month deferred payment period. So his practice is up and running, and he hasn't actually had to pay a penny towards his TRT machine, and it's keeping his practice running. He's doing a great job. And
what was the other thing? I personally will say to these doctors, and we did it with the doctor you're talking about, Dr. Ron, who's amazing, and his dad, and they've got a wonderful clinic. one of the things we said is, listen, after 12 months, if you're not completely happy or you're failing in one spot or another, it's just not working. Hey, we'll help you sell it within 4 to 6 weeks. We're only able to bring in, I think, 6 to 8 right now per month. So, and we've got 10 to 15 people a month that want this. So even if you want it now, there's basically a 3-week wait. But God forbid something happens to one of our doctors out there and their wife needs us to help them get that, sell that clinic or sell that device. We'll help get it out of there within 4 to 6 weeks, if not sooner.
So I want you to take that, digest it, put it in the back of your mind, and then forget about it. Because the reality is the protocols that are put in place, the marketing that we have, the videos that we have, the podcasts that have been done, the research that you're going to go and research and read are all going to show you that this machine is going to do amazing things to your patients. And it's just going to lead to multiple new patients coming into your practice. Not to mention, let's be real about it. You have X number of patients already in your clinic. Now you have a new tool to help them with. And then you can spread from there. So utilizing the protocols that we put together, the marketing that we put together, you could take that little piece of information, put it in the back of your head and forget about it.
It's a safety net.
Need it. Yeah, there you go. It's a safety net.
But
what they wear when they're cooking up your lunch at high school, right? The little safety net.
Now listen, the doctors out there, like Dr. Duncan McCullum out in Santa Cruz, California, he's been practiced 34 years, hurt his shoulder. He sent me the most beautiful Christmas card this year because he said, Matt, everything you told me came true. I mean, he's like, I'm so sick of working with people that promise you the world and deliver you nothing. He goes, we did both, right? And, it comes from, we want to serve, right? I don't do this to make money. I retired at 40. I'm happy. I'm set. But I am on a mission, right? I am on a mission to get this device in every state in our country and then in every large major chiropractic clinic across the country. And you want to be first in your state, right? You want to be in a category of one and set yourself apart from everyone else. You look at Elon Musk and Tesla, they are what's called blue ocean. All the other car manufacturers, they're in the ocean and they're fighting it out and there's blood, and any little bit of blood, it becomes a red ocean, right? And Elon Musk is 10 to 15 years ahead of all these other car makers when it comes to developing electric vehicles. Maddie, I'm an early adopter. How many Teslas do I have?
I was going to say, you're going on your third, I believe now.
I'm gonna get the Y next, the little SUV. But no,
you're
I
gonna
love
send
them.
it to me. That's so nice. I mean, so nice of
That's
you.
right. That's part of our deal.
Right.
All right. Well, listen, we're getting a little punch drunk here. So, hey, we
Friday.
Went over some good stuff, Matt. Wonderful information. Where can we see you in the future? We're going to see you out on the PGA Tour, touring around with some of these docs.
You might see me out there, but I just, again, I want to give a quick little plug in here. And Matt, you're doing amazing things. You've been so impactful on so many people's lives out there, so many different patients, and helping people in so many different ways, helping clinics. And you've been an inspiration to me, and you've always been somebody that I admire to be more like. And I really do appreciate you having me on here. You are a mentor of mine, and you will always be a mentor of mine, even though I beat you on the golf course.
You do. You drive. You have a better drive than me.
Good, yeah, but I.
All right. Well, listen. But we
me.
will. I mean, hopefully, one of our goals is as you tour around with the PGA, you'll actually have a device, and you'll be able to maybe do demos. And then in the future, as the PGA Tour comes into those areas, we want to use that device that's there. Right?
Okay.
They are mobile. They're 51 pounds, but we don't want to lug it. I'm like that Will Smith in the Pursuit of Happiness, where he's lugging his stuff all around. That's kind of how I feel sometimes. So I love it when we put these clinics, we put them in clinics around the country, and we can send doctors there to get demos or other patients. So Matt, thanks so much for taking time out today. Be safe, keep your family healthy, and look forward to you in the future talking. Chat. Thank you.